My name is Philip Dufresne, and I used to live on the street, and now I live in supportive housing at Houseland Community Homes, and I've been living there for the past 17 years. And I advocate for more supportive housing on the DREAM team, and I'd like to tell you how supportive housing saved my life, and also why we need a long-term affordable housing strategy to protect low-income tenants and to provide programs and services for people who've experienced homelessness and mental illness. After graduating with a BA in anthropology from Concordia University in Montreal, I moved to Toronto to look for work. And I saw everybody around me getting jobs, getting married, having kids, buying a house, buying a car, and I wasn't doing any of these things. So I began to realize, well, I was different than everybody else. I just didn't seem to fit in. And the only kind of jobs that I could ever get were minimum wage, unskilled labor jobs that kept me living in poverty. And I did these jobs for a while because I figured they were better than nothing. But after a while, I found these jobs very boring, and I became very frustrated. And then when I decided not to do these jobs anymore, I started to look around for other work, but I couldn't really find anything that was any better. And my frustration, it turned to anger, and I started to get into a lot of fights with my family, and they had me committed to Sunnybrook psychiatric ward because they thought I was having a nervous breakdown. And I fought the doctors the whole time I was there, and after 3 days they finally let me go. But I still had difficulty finding work, so eventually I ended up on the street. And I began thinking to myself, why do I deserve to be here? I don't really deserve this. Nobody really does. And so for the first time in my life, I started looking at the whole picture, and I began to realize that it wasn't just me that was messed up. It was the entire economic and social and political system. And that's why I never really tried to do things the way other people did. I was looking for something better. And living on the street, it completely changed my outlook on life. It made me more determined than ever to fight poverty and injustice, and it made me a stronger person in the process. And after living on the street for 1 year and in a single room in a house for 2 years, my hostel outreach worker helped me get into supportive housing at Houseland, and that's when my life began to turn around. And not only has Houseland given me decent affordable housing and support services, it's also given me a chance to develop skills that I never really had a chance to use before. And that's when I discovered that I had a passion for volunteer work. So, and for the first time in my life actually began to have meaning. I didn't really know what I wanted to do with my life before then. And I realize now that after living on the street, anything positive that happens to me is a miracle, because I could just as easily have ended up dead, and I really wouldn't be alive today without supportive housing. And all Ontarians need to have supports and programs to ensure that they can equitably access and maintain their homes. And these are some of the ways that this can be achieved. First of all, strengthen tenant protection laws to ensure fairness to low-income tenants. Protect tenants from unaffordable rent increases. Invest in culturally appropriate supportive housing for people with mental health issues, addictions, HIV and AIDS, or disabilities. Create safe emergency housing for people or for women who are leaving abusive relationships. Shelters need to be maintained so people who are homeless have a chance, to look for better housing or more permanent housing. And services need to be fully funded and available for people who are experiencing homelessness and housing insecurity. Also, we need eviction prevention programs in place to help keep people housed. Culturally appropriate discharge plans for people leaving hospitals, shelters, child welfare, mental health, and correctional facilities. They need stable, affordable housing to go to, and also the programs should be uploaded from the municipal government to the provincial government. And really, I'm alive today because of supportive housing. However, like many Ontarians, I not only need the supportive housing, I need support services in place to help me maintain my housing. So it's not just enough to have affordable or supportive housing. I need the support programs in place too. And we need more supportive housing, more protection for tenants, and more programs for homeless and vulnerable people if we truly expect to have affordable homes for all. And obviously, if affordable and supportive housing was available for whoever needed it, we wouldn't have a homeless problem to begin with. And more affordable and supportive housing would cost the government more money eventually, or initially, but it would save money on social services, on health care, and on correctional services. So in the long run, the government would actually be spending less money. And once people who have experienced homelessness have decent, stable housing, they can contribute to the community just like anybody else. But you know, nobody can do anything with their life if they don't have a decent place to live. Therefore, everybody in society benefits from decent, stable, affordable, and supportive housing. Thanks. And now.